Hi guys, today we are talking about myocardial infarction, and that is a sudden restriction of blood supply to a portion of the heart, causing either ischemia and death to this muscle tissue. Okay, so first I want to talk about cause. Coronary artery disease and thrombosis are our primary causes of an MI. Second, we'll talk about assessment. The first piece being our subjective data. So we're going to see chest pain. That's going to be unrelieved by rest, okay? We also are going to see pale skin. These patients are going to be diaphoretic, mottled, so have some nausea, anxiety, might see shortness of breath, palpitations that worsen with activity. So that's our subjective data. Now let's see what our objective data is going to be. We might be, the patient might be hypotensive or bradycardic. We're going to see maybe an ST elevation on a 12 lead, specifically for a STEMI, and then elevated troponins, most sensitive. We see elevated CKMB and CK. Now let's talk a little bit about therapeutic management, okay? We have 4 different things we're going to look at here. The first one we'll talk about is medications. What are some anticipated medications we might see? The first is thienopyridines or clopidogrel. We might see heparin, renin-angiotensin blockade, ARBs or ACE inhibitors, oxygen, morphine if indicated by the facility, beta blockers, nitroglycerin. Number 2 for therapeutic management is we're going to monitor the EKG. Number 3, we're going to have the patient rest. We want to decrease O2 demands of the heart. And lastly, our last therapeutic management is to anticipate the provider orders, okay? So some of the things we're going to expect is 12-lead EKG, cardiac enzymes every 3 hours times 4, thrombolytics unless there's a contraindication, and percutaneous transluminal coronary angioplasty, PTCA, which is going to open clogged arteries. Okay, so again, we are talking about myocardial infarction, which is a sudden restriction of blood supply to a portion of the heart, which is damaging the muscle tissue. All right, guys, thank you and happy nursing. This has been another episode of NCLEX Flash Notes podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's NCLEXbook, NCLEXBOOK.com. Happy nursing!